Fragile X syndrome is a genetic condition, so that means that it's in the DNA. It's actually a very common condition. In fact, it's the most common cause of autism. Most common genetic cause of autism. And it's a condition that has a lot of impacts on behavior, intellect, development, mental health. And the great news is that it's not life-threatening, and there are a lot of therapies and treatments we can do to help people with this condition. Now, it's not a curable condition, but like I said, there are a lot of therapies and treatments and things that we can do to help people. And a lot of people with this condition live very happy, long, full lives. A couple things to know about this. Like I said, it's primarily a behavioral and intellectual and mental cognition condition. So there are a lot of people with this condition that have autism. It can also cause ADHD. Other mental conditions like anxiety or depression are much more common in people with this condition. And there are a couple physical manifestations, which means that people with this condition can have like a tremor or sometimes unstable on their feet. They don't need anything like wheelchairs. They usually function very well, but there are a couple things that you might see physical symptom-wise. So with just knowing that your child has this condition, we can move forward with some therapies and with the medical team set up to help. So that means possibly getting some educational support at school, maybe getting some private tutoring, and it really just depends on how this condition manifests in your child. A couple things that are important to know, because it is genetic. There's a chance that if you plan on having additional children, there's a chance that they might have this condition as well. And also in people with this condition, females, it is less common in females, but in females there is a chance of some fertility issues down the road. So that's something we want to keep in mind and think about for your child. I know now it's very early, but just wanted to put it out there that it is a complication of this condition potentially. So you could talk to somebody about maybe fertility in the future when down the line. Otherwise the prognosis is very good. It doesn't affect life expectancy at all, and it's good that we have the diagnosis early.